Good afternoon, Chairman Blumenthal, Ranking Member Johnson, and other distinguished members of the subcommittee. I am Megan Tinker, Chief of Staff for the HHS Office of Inspector General. I appreciate the invitation to discuss OIG's important Medicare Advantage work. Today, I will highlight a critical issue assessed by OIG reports, potential barriers seniors may face when accessing care under Medicare Advantage. Based on data released this month, 30 million individuals, or 50% of all Medicare enrollees, are now in Medicare Advantage. That is a significant number of Americans who rely on plans to authorize and pay for the care they need. This expansion has been rapid. Just a decade ago, only 29% of Medicare enrollees were in Medicare Advantage. Fast growth has increased vulnerabilities and the need for robust program integrity measures. OIG work has demonstrated that the risks of fraud, waste, and abuse in managed care are significant. Last month, Inspector General Christy Grimm spoke to a group of managed care plan executives. She emphasized that Medicare Advantage plans need to step up their efforts and focus on preventing the types of issues OIG work continues to find. One area of concern highlighted by OIG work and raised by this subcommittee are plan practices that impede access to care. I would like to highlight some of OIG's work on this topic. In an evaluation published in April of 2022, OIG found that Medicare Advantage plans sometimes delayed or denied enrollees access to medical care, even though the care was needed and met Medicare coverage rules. In other words, these services likely would have been approved by original Medicare. For many of these denials in our review, Medicare Advantage plans used internal clinical criteria that are not required by Medicare. For example, a plan denied a request for a CT scan that was medically necessary to rule out a life-threatening aneurysm. The denial was because the beneficiary did not first have an X-ray. But Medicare has no such requirement. In another case, a plan denied a request for a walker for a 76-year-old patient with post-polio syndrome. Having a right knee that buckled, the patient was at risk for falls, and denying the claim went against CMS's policy to cover equipment that is medically necessary. Medicare Advantage plans' internal criteria are supposed to be no more restrictive than original Medicare. However, the capitated payment system in Medicare Advantage creates a potential incentive for insurers to deny access to services for enrollees. Plans are paid a fixed amount of money each month for each enrollee, regardless of the number or cost of services that are provided. To address these issues, OIG recommended that CMS issue new guidance on the appropriate use of clinical criteria and that CMS assess the use of these criteria in its audits of Medicare Advantage plans. OIG work has already had impact. Last month, CMS issued a final rule that puts in place new requirements to protect enrollees from an inappropriate use of prior authorization. The rule streamlines prior authorization requirements and strengthens protections against denials for medically necessary services. OIG appreciates and shares your interest in ensuring that Medicare Advantage enrollees get the medical care they need. However, with our limited resources, comprehensive oversight of HHS programs is challenging. We only have 2 cents to oversee every $100 HHS spends. We conduct efficient, consequential, high-impact oversight work with our limited resources. But much more needs to be done to thwart fraud, identify misspent funds, and protect people from harm. To be candid, without more resources, we will be unable to keep pace with the threats to the department's programs. That is especially true for Medicare Advantage. OIG is turning down between 300 and 400 viable criminal and civil healthcare fraud cases each year. These uninvestigated cases represent unchecked fraud and the potential for patients to be put in harm's way, including individuals enrolled in Medicare Advantage. Notwithstanding rigorous efforts by OIG, HHS, and Congress, Serious fraud, waste, and abuse continue to grow and threaten HHS programs. If enacted, the President's FY 2024 requested resources for OIG would go a long way towards addressing shortfalls, particularly with respect to combating fraud and increasing our oversight of Medicare Advantage plans. Thank you, and I'm happy to answer any of your questions.